We were not expecting the finding that menopause did not worsen disability accumulation in women with MS. However, this is an incredibly reassuring finding for women. I work as a clinician as well as a researcher, and I see a lot of women approaching the perimenopausal and postmenopausal times. And it's been difficult to counsel them about what to expect from their multiple sclerosis at that time. And I think this study allows us to provide a lot of reassurance to women that for most women with multiple sclerosis, menopause and being postmenopausal should not have long-term implications for disability worsening for them. So what I would say is while this study does not show that menopause is having long-term implications for MS disease course, it is certainly possible that the symptoms of menopause may be exacerbating some of the symptoms that women have associated with their MS. And for that reason, it's very important that women recognize the stages of perimenopause and menopause, and that they talk to their doctors and their health providers about how best to manage those symptoms proactively, so that they don't find themselves unnecessarily burdened by the symptoms of menopause. There are a number of things that we can do to help women through that menopausal transition. And interestingly as well, a lot of those things that we can do to help manage menopause will also be very beneficial for MS. In MS, we know the importance of maintaining a healthy diet. We understand how effective regular exercise can be. And all of these lifestyle modifications will be very helpful for menopause as well. And then we also know that it can be, for a lot of people who are having significant vasomotor symptoms, managing those therapies either with menopausal hormonal therapies or non-hormonal therapies are also options for managing those vasomotor symptoms as well. So being proactive about helping to manage those symptoms can really help, because those symptoms, not only do they cause the discomfort of a hot flash in the moment, but they also can have significant impacts on things like sleep, which then leads to growing sensations of fatigue, and also on women's cognition as well. I think there's still a lot we don't understand about the interplay, and there's so much more we want to research in this topic. It's a very exciting field for us. A couple of key things I think coming up is that we are very curious to understand, to take a deeper investigation at cognition, and to see if there's anything more subtle potentially that may be able to be detected with a more targeted analysis, just looking at cognition, to see if there's any changes that in fact do occur around that perimenopausal and menopausal transition. And the other thing I think the jury is still out on, because we just do not have enough data on, is the role of hormone replacement therapy. We just don't have any large randomized control trials that help us to guide women with these therapies with menopause. So that's another watch this space.